How to cure adenoids in 1 month and save them from surgery. My name is Dr. Kravro, and my mission is to help as many people as possible in Russia and around the world to become healthy. I took these methods from my health programs, the effectiveness of which, before I start, I will share with you the golden rule of success of these methods. We need to use a comprehensive approach, that is, to implement everything that I will tell you further. And if you implement everything that I will talk about further in this video, then the adenoids simply will not stand a chance. I guarantee you this. There are 2 problems associated with adenoids. The presence of inflammation is the first factor. The second is their enlargement. The first thing to do to cure adenoids is to determine the cause of inflammation and the cause of their enlargement. She is always there. Remove the cause, the inflammatory process goes away, the adenoids start to shrink, the problem is solved. The most popular reasons. First, these are viral infections that live and multiply in the lymphoid tissue of the nasopharynx, that is, in the adenoids. The most popular are Epstein-Barr, cytomegalovirus, and herpes virus type 6. Be sure to exclude these viral infections. In second place in the causes category are allergic processes in the body. And it's not necessarily an allergy to inhaled allergens. It may be or it may not be. Any allergy in the body, it harms the immune system. And if the immune system becomes angry, it doesn't let any viral or bacterial infection pass by. That is, for any virus passing by, the immune system triggers an inflammatory process. First of all, it starts in the adenoids. And if a child gets sick every month and sometimes even twice a month, then the inflammatory process just doesn't have time to subside in the adenoids and it becomes constant there. This becomes an additional factor that disrupts the work of the local immunity. Therefore, if you have never been examined, rule out an allergy in the child's body. The simplest thing you can do is to take a pediatric panel of allergens. That is, to look at the blood for specific immunoglobulin E, specific antibodies to the most popular allergens in children. Bacterial agents were the 3rd most common cause. That is, when a long-term inflammatory process is launched in the adenoids, they become larger, special passages go inside, microbes begin to multiply in these passages. The immune system, of course, sees and reacts to them, but it can't cope with them. But this increased content of bacteria, it in turn, first of all, supports the inflammatory process because the immune system tries to fight them through inflammation. Secondly, this situation, again, in turn disrupts the work of the local immunity. That's why the child is often sick. That's why there is a constant inflammatory process and a vicious circle. If we see signs of bacterial inflammation in the throat when examining a child, we take into account the sensitivity of this bacterial flora. This is a separate topic for a separate conversation, but the main thing is for you to understand that if the doctor sees signs of bacterial inflammation during the appointment, it means this needs to be taken into account in the scope of your treatment. Other less common causes include reflux from the gastrointestinal tract into the upper respiratory tract, especially when the child is sleeping. This is called gastroesophageal reflux disease. That is, the stomach contents flow back into the esophagus. This irritates the throat, and this can irritate the adenoids. For diagnosis, an ultrasound of the child's stomach is done with a water siphon probe. That is, you come on an empty stomach, the child drinks water, and based on the ultrasound results, they see whether this liquid flows back into the esophagus or not. If reflux is detected, then such a patient is referred to a gastroenterologist. Iron deficiency in a child's body, insufficient function of the thyroid gland, hypothyroidism. Vitamin deficiency. These are all factors that disrupt the immune system, and the child begins to get sick often. And this in turn leads to a chronic inflammatory process in the adenoids and their enlargement. Therefore, if we check the child for everything, we look at the level of iron in the blood plasma, ferritin, We look at the hormones of the thyroid gland. This is T4 free and thyroid stimulating hormone. We look at the level of vitamin. Of course, there can be many causes of the inflammatory process in the adenoids, but I will name the most popular ones for you. And your task is to find this cause and work on it together with the doctor. It's all logical. If viruses are detected, special antiviral drugs are prescribed, or drugs that normalize the work of the immune system most often. Complex treatment is prescribed primarily for adenoids. Bacterial flora is detected, which supports the inflammatory process, so we treat this bacterial flora. Food allergy has been detected, which means the allergen is removed from the diet for some time, that is, a diet is prescribed. The immune system calms down, starts to work normally, and the child becomes healthy. These were traditional medical reasons, but there are also psychological reasons. They can be absolutely different, but what is important here? It's important that any of our thoughts evoke certain feelings in our body. Feelings in the body trigger reactions of our body, including reactions of the central nervous system, the vegetative nervous system. A simple example, remember your first date now. Close your eyes and remember that situation. And pleasant feelings arise in the body. These pleasant feelings trigger healthy reactions in our body. But if you now recall the scariest situation in your life, then absolutely different feelings in your body. And this begins to trigger stress reactions. For example, if in the scariest situation you wanted to hide, to tense up, then your body, even when you recall this situation, will trigger the same reactions. So certain thoughts, a certain environment can trigger various reactions of his organism, his body. The child can tense up, and in this state and at certain tensions in his body, the blood circulation in the throat area worsens. The immune system works less effectively, which contributes to its improper functioning, to the insufficient work of the immune system, or conversely to its hyperaggressive function. But the main thing is that this begins to lead to the fact that the child often gets sick and problems develop in the adenoids. Therefore, psychological reasons, this is a separate, of course, topic for discussion. We are not about this today, but nevertheless, they are always there. And if you additionally, that is in addition to working with medical reasons, turn, yes, that is, to psychologists who can and know how to deal with this, know how to diagnose, and most importantly, know how to remove this, it will be just great. The reasons have been identified, worked with them, let's move on. The next step is actually the treatment of adenoids. And the first thing, which we have already partially discussed, is the elimination of causes. If we find bacteria, we work with bacteria. If we find viruses, we work with viruses, and so on. What can be added here? First, any moistening of the mucous membrane improves the work of the local immune system. The child gets sick less often, which contributes to recovery. Therefore, we moisten the nose with either saline or sprays with seawater, isotonic, which correspond to saline in concentration. We do this in the morning and evening, and it's even better 3 times a day. For instance, before and after visiting the garden, after school, and before bedtime. The gold standard for treating chronic inflammatory process in adenoids is intranasal glucocorticoids, that is, special hormones synthesized for the nasal mucosa, which practically do not get into the blood and do not have a systemic effect. Although this is the gold standard of treatment, unfortunately in modern clinical recommendations specifically for the treatment of adenoids, these drugs are not included, so some people use them, some do not. But we definitely see a good effect from the use of these drugs, from their long-term application. These are nasal sprays that we use a certain number of sprays depending on age, a certain number of times a day, over a long period of time, usually a month or more. These are mainly sprays based on mometasone or fluticasone. Usually we use them in complex treatment, that is, we work with the causes, prescribe these sprays and so on. We can also use preparations based on natural antiseptics, for example, thuja oil. In most cases, it is of course sold as homeopathic. That is, in fact, there is nothing there except olive oil. But nevertheless, in Russia you can find thuja oil, which really goes into the composition. That is, without all sorts of letters 612. That is what they write in the composition of homeopathy. What is homeopathy? They loaded a substance into a liquid, then removed it from there, and this liquid remembers this substance. So drops that actually contain thuja oil in their composition have a big effect. While not very easy, finding such in Russia is possible. We prescribe thuja oil 2 to 3 drops in each nostril 2 to 3 times a day for 3 to 4 weeks. It frequently rescues the situation. We also sometimes use a plant-based preparation that is included in international recommendations for the treatment of rhinosinusitis. But again, in Europe, they do not separate. Yes, that is, adenoids go under the category of rhinosinusitis, and there is a preparation called Sinopret, specifically with proven action for the treatment of rhinosinusitis. But in addition to treating the nose and nasal sinuses, it also has a positive effect on adenoids. We use it according to the instructions when there are no contraindications. Of course, any medications we're discussing today can have contraindications, so it's necessary to consult a specialist. Let's move on. Step 3. This is about creating optimal conditions in your homes for the child's immune system to function. 2 physical factors are important here. These are humidity and temperature. For the mucous membranes to be moist, for the immune system to work well, the humidity in your home should ideally not be less than 50–60%, and the temperature should not exceed 24 degrees Celsius. If the temperature is higher and the humidity is lower, and if these 2 factors are combined, the mucous membranes start to dry out, the immune system works less effectively, the child starts to get sick often. Therefore, humidify the air and lower the temperature in your home. The 4th step is health methods. Now I will tell you about the most effective ones specifically in relation to a child's adenoids. The first is winter sports. That is, when a child is engaged in sports specifically in cold conditions, his body functions maximally effectively and the work of the immune system improves. First place here is ice sports. This is figure skating, hockey, skiing, and various other types of winter sports. The swimming pool takes the next step after winter sports, so if there is no possibility to play hockey there, for example, or figure skating or skiing, then accordingly you can go to the swimming pool. Let's move on. The next method is hardening. I separately distinguish hardening for a child's throat and hardening of the whole body. We won't go into detail here, all this can be read on the internet. But hardening has a very good effect on the adenoids because the child, he does not stress about the cold, his immune system works better, he gets sick less, and accordingly, the inflammatory process in the adenoids, it goes away. The next method is massage on reflexogenic points, affecting the immune system, which improves its work and as a result helps to reduce the inflammatory process in the area of the adenoids. For instance, a 9-point massage as per Umanskaya. You can also figure this out and gradually incorporate it into your practice. There are breathing techniques that optimize the condition of the upper respiratory tract, which, when performed correctly, that is, they provide a massage effect of the air on the lymphoid tissue of the throat, as a result of which blood circulation improves. Again, the immune system works more effectively, which contributes to the reduction of the inflammatory process in the adenoids. The next step is the use of psychological techniques for the child's health improvement. You've probably noticed that there is a mother's influence on the child's health condition, and it is indeed so. But it's not because the mother is bad, on the contrary, there is a dependency here. That is, the more the mother cares about the child's health condition, about what is happening with him, the greater this influence. Why? Because the mother starts to worry, and children, they copy all our reactions in order to adapt to the environment, to survive in it. And when the mother, for example, brings the child to the garden, sees a snotty child, sees a snotty neighbor's child, thinks, well, that's it. Now we will get sick again and again, we have problems with adenoids. The mother has a stress reaction. It manifests itself in her appearance, and children up to 7 years old, they can easily read from the mother's appearance, yes, what is happening in her body, and copy these reactions. As I said, this is essential for the child to adapt to their environment. But here it plays a reverse role because the stress has gone into the child's body. The blood circulation in the respiratory zone deteriorates. The immune system, on the contrary, somewhere may react hyper-aggressively. Because the mother was scared, the immune system becomes more evil, and accordingly to those viruses and microbes that fall on the mucous membrane, at first there is no immune response and then it starts, but such a hyper-aggressive one is included. To put it bluntly, the child naturally gets sick. In my programs and in my observations, I see that the psychological factor is always there for everyone. Clearly, any mother needs to remove the anxiety associated with the child's illnesses, remove the secondary benefits that are not recognized, but they are always there from the fact that the child is often sick. Although most of you now have a resistance, what benefits? We don't have them. And most importantly, a mother needs to start living her own life, take care of herself first and foremost, about her energy, in order to have the strength to come to the health of her child. But most importantly, if you want to save your time and energy, get clear instructions on what and how to pass, how to properly examine a child in order to understand the cause that causes problems with the adenoids. Get detailed instructions on health methods, what is being done, specific techniques, detailed video materials. If you want to work on psychological factors, remove anxiety, remove hidden benefits, restore your resource state, your energy, come to the webinar. It will take place on the 20th of January at 16 o'clock Moscow time. There I will tell you everything in the most detailed way, but the most important thing is that it will not just be a webinar, but a full 2-week course on which I will give you all the methods that are being discussed in this video. I will tell you how to properly implement all of this so that it works and so that you can save your child's adenoids. Here now, a link to the webinar will appear. It is also in the description under this video. If you are watching this video after January 28th, you have absolutely the same opportunity because you can watch the webinar recording here and there in the description using the same link. We will also provide you with the same 2-week courses with all the methodologies. So come, I'll be glad to see you. Take good care of your health and well-being. Your Dr. Krabrov.